Robotic cardiac surgery Q&A. Hello, I am Dr. Varun Bansal, consultant CTVS, MICS and Robotic Cardiac Surgery, Indraprastha, Apollo Hospitals, New Delhi. Robotic cardiac surgery is a method of surgery that allows the surgeon to perform complex surgical procedures with greater precision, control and flexibility. What is robotic cardiac surgery? Robotic cardiac surgery is heart surgery done using cutting-edge robotic technology through very small cuts in the chest. With the use of small instruments, the surgeon can reach the heart without cutting open the chest bone. The surgeon inserts a small camera and small robotic arms through these small cuts. Specialized tools are used to stabilize the part of the heart on which surgeon works, in a precise manner with a magnified view. The surgeon operates while sitting on the robotic console, controlling all the movements of the robot, while a nurse and another surgeon assist him to perform the surgery on the patient's bedside. What all surgeries can be done by robotic cardiac surgery? Robotic cardiac surgical procedures include CABG, mitral or aortic valve repair and replacement surgery, cardiac and thymus tumor removal, heart wall defect repair like ASD and VSD. How is it different from conventional heart surgery? Conventional heart surgery is performed by splitting the central chest bone and with or without placing the patient on heart-lung machine to stop the heart while surgery is performed. Robotic cardiac surgery is performed through tiny cuts without any cutting of the bone. What are the benefits of robotic cardiac surgery? The main benefit of robotic assist cardiac surgery is that it does not involve cutting open the breastbone. This reduces trauma to the body and wound infection, less blood loss, drastically reduced postoperative pain, insignificant scars, shorter hospital stay 3 to 4 days. Patient usually can return to full activity and work early within 2 weeks. Benefits of robotic surgery for the patient? More precise surgery. Less pain. Fewer surgical complications. Reduced need for hospital stay. Shorter recovery time. For the surgeon? An enhanced visual field. Superior dexterity. Better access to areas of concern. What are the risks of robotic cardiac surgery? One of the main benefits of robotic cardiac surgery is that it has fewer risks than conventional surgery. The surgeon does not have to cut through the breastbone to open your chest. This removes many of the feared complications of open chest surgery. At some instances, the surgeon may not be able to complete the surgery using the robot and might need to open the chest to complete the procedure. The risk of that scenario is nearly 1 to 2%. Am I eligible for robotic cardiac surgery? Most patients are suitable to undergo robotic cardiac surgery. However, there may be a few patients with poor heart function, previous lung problems or who have had previous chest operation who may not be suitable. The robotic specialist surgeon would review the patient and decide the above. Are patients with lung disease eligible for robotic cardiac surgery? Yes, patients with chronic lung disease are eligible for robotic assist surgery. However, the fitness of the patient shall be assessed by the robotic specialist surgeon and a pulmonologist to assess and decide about fitness. Additional tests like PFT, pulmonary function test, might be required to assess fitness prior to the surgery. Are patients on hemodialysis eligible for robotic cardiac surgery? Yes, patients with chronic kidney disease or who are on hemodialysis are eligible for robotic assist surgery. Robotic surgery is even more beneficial to them when compared to conventional surgery, as the risk of bleeding and infection are lesser in robotic assist surgery. The robotic specialist surgeon and a nephrologist would review the patient and decide the above. Are patients with liver disease eligible for robotic cardiac surgery? Yes, patients with liver disease are eligible for robotic assist surgery. Robotic surgery is even more beneficial to them when compared to conventional surgery, as the risk of bleeding and infection are less, and recovery is faster in robotic assist surgery. The robotic specialist surgeon and a gastroenterologist would review the patient and decide the above. Are there any after effects or side effects of robotic CABG? No, robotic cardiac surgery has no after effects or side effects additional to that of conventional cardiac surgery. It is actually beneficial as it leads to lesser pain, fewer complications, and quicker recovery. What is time for recovery after robotic cardiac surgery? In robotic surgery, recovery is quick. patients usually stay in ICU for 1 to 2 days. Are usually discharged from hospital in 3 to 4 days after surgery. They are able to return to full normal activity in 10 to 14 days. What is the success rate of robotic cardiac surgery? Outcomes of robotic cardiac surgery are extremely well due to low injury to body, precision surgery, fewer complications, quicker recovery. When compared to open chest surgery, what is the cost range and variance for robotic cardiac surgery when compared with conventional surgery? Robotic cardiac surgery is slightly more expensive than conventional surgery due to the added cost of the robotic arms and instruments. The benefit of early return to normal activity and reduced risk of complications outweighs the additional cost. Does insurance cover robotic surgery? Yes, most insurance companies cover robotic surgeries. Recent IRDAI guidelines recommend insurance cover for robotic surgeries. Some may need additional letter from the operating team regarding robotic costs. However, final coverage may depend on the policy.